it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, here today to answer more questions that you all may have about your teeth, gums, mouth, braces, and orthodontics. And today we're venturing a little bit more outside the orthodontic spectrum to talk a little bit about just some oral health questions that some of you have had. So the question today I got was about bleeding gums and why would your gums bleed? So I know blood is never good. It's gross. Nobody likes it. In dentistry, we see it a lot, so it doesn't really freak us out. But bleeding gums are never normal. So remember that. That is something that needs to be fixed. So it could be something as minor as just some gingivitis, and we'll go over what to do about that. Or it could be something significantly major that maybe isn't really related to your teeth, but it's related to your body or systemic health, a disease, and it's manifesting or showing one of its symptoms in your mouth through bleeding gums. So remember, if and when you ever have bleeding gums, it's not something that's okay. It is something that you need to investigate. First thing I recommend that you do, if you haven't done it already, is to see your dentist, right? Easy, right? I know people think, oh, it's COVID, I shouldn't be seeing my dentist, but you should. If you haven't been to your dentist for a normal, full exam, cleaning, an evaluation every 6 months, it's time for you to schedule them. So of course you should do that, right? Another thing that you should do, of course, is visit your physician. If you haven't had a regular checkup and blood work, if you're an adult, good idea to go ahead and get that scheduled as well. So do those two things. Let's tackle the most obvious, answer, differential diagnosis, which would be most likely gingivitis. Most likely just a mild gum infection, easy to fix. First thing I recommend that you do is start flossing twice a day. If you've never done it before, I know everyone rolls their eyes, but magically flossing is so easy, so cheap. I know people don't love doing it, but I'm telling you, it will transform your life, transform your health. And it is a $2 investment per month, cheaper than one Starbucks, that will improve your total body health, improve the way you feel, improve the health of your teeth, let you keep your teeth for longer. It'll actually save you thousands and tens of thousands of dollars over your lifetime by investing that $2 right now, because flossing is the easiest way to improve your health, your total body health. There's so much correlation between having plaque and bacteria entering your bloodstream through unhealthy teeth and gums, affecting your whole body health. And there's even right now, they're showing that COVID is indirectly related to periodontal disease, which is indirectly or directly related to flossing and brushing. So brushing only gets the flat surfaces of your teeth. It does not get in between your teeth or under your gums. So you have to floss to get the rest of the plaque off, and it's easy. And if you really, really hate flossing, I recommend getting a water pick, which is a little machine. I like the cordless one that you can fill up in your bathroom and take it in your shower and just shoot power wash your in between your teeth. It works just as well. It works really good. You can do that instead of flossing if that's what you'd like to do. It's very effective. Other thing you can use is Sonicare has an air flosser. I don't think that's quite as good as the water pick, but yeah, that's pretty much it. Floss twice a day. Remember, when you first start flossing, it'll probably take a week or two before the bleeding goes away. As a matter of fact, the bleeding will likely get worse for a few days. So it's a little gross initially. You have to push through it. You can't quit. Keep flossing and brushing twice a day, or at least brushing after every meal. That includes lunchtime. I know people think that's a little nutty, but I always do it. I remember when I first went to dental school, I was like, oh my goodness, everybody's brushing their teeth after lunch. I never used to do that. And I didn't floss till I went to dental school because I didn't really understand the importance of it. And then once I did, oh my goodness, you'll never stop again. You'll always have floss with you. So yes, but on the systemic side, most likely if you get a clean bill of health and it's not that, it could just be an infection that's localized in one area. Could be a really bad cavity, could be a broken tooth if you're not having other pain. And it could be something systemic like diabetes, various lymphomas, leukemias. There's a lot of systemic conditions. I know I'm not trying to freak you out. Could be pregnancy as well. Pregnancy does manifest with pregnancy gingivitis. Even if you have really good hygiene, there's some people that sometimes get some bleeding during pregnancy. You have to be even more amazing with your hygiene during pregnancy. So don't freak out, but just don't let it go is my tip for you. All right, thanks so much.